A labiaplasty is a surgery that's designed to reduce the size of the external female genitalia, whether that's the labia majora or the labia minora. Usually when somebody says labiaplasty, they're referring to reduction in size of the labia minora. You know, this is one of the fastest growing procedures in the United States. According to the American Society of Plastic Surgeons, the fastest growing cosmetic surgeries now in the United States are #1, the Brazilian butt lift, and #2, the labiaplasty. This is becoming a much more popular surgery because 1, people are becoming aware of it. 2, with changing fashions and grooming habits, women themselves are becoming more aware of the appearance of their labia. And 3, that the surgery is becoming safe and is offered by many plastic surgeons. Most women that come to me requesting a labiaplasty have 2 specific complaints, or a combination of. Usually the main complaint is that they simply don't like the appearance of their labia minora. They may feel that the labia minora is too protuberant, too large, or too elongated, and they would like that reduced in size. The other very common complaint is discomfort. With an enlarged labia minora, it can be very difficult to exercise, to have sexual intercourse, or simply to move around. And so those are the most common complaints of a woman requesting a labiaplasty. 1, an improvement in cosmetic appearance, and 2, an improvement in function. Luckily for most patients, a labiaplasty can be performed under local anesthesia. Sometimes we give oral medications for sedation, and occasionally we give IV medications, medications through the vein for sedation. If a patient is having another surgery performed at the same time, say a breast augmentation or Brazilian butt lift, then we would maybe do their labiaplasty under general anesthesia. The labiaplasty surgery itself takes about an hour, and it's a relatively simple procedure performed here in the office. During the procedure itself, I mark the area of excess labia minora, trim it and specifically measure to fit, and then cut out a wedge of tissue and merely sew the existing labia minora back to the posterior aspect of the vaginal introitus. Dissolvable sutures are used, so patients don't have to come back for suture removal. The sutures dissolve in approximately 2 to 3 weeks and are able to resume sexual activities and a normal exercise patterns by 2 to 3 weeks. There is no age limit or age cutoff for this surgery. I performed labiaplasties on patients as young as 18 and up to 72 years old. So the condition affects anybody really, regardless of age, ethnicity, or childbearing status. And really, women seeking a labiaplasty either simply want an improvement in their appearance or a reduction in discomfort during certain activities.